So I'd like to introduce our next speaker, Vernon Bainton, who's a great supporter of Health Careers Live and Chief Medical Officer at Havas Lynx. He'll be answering the question, how can better communications and creativity be applied to healthcare? Hi, are you there?
I am. Can you hear me?
Yes, I can. How are you doing today?
Fantastic. I'm very excited to be here. What a great lineup you've had on today. I'm, very enthused and looking forward to the session.
Well, I can't wait to hear from you. I'll pass over all the power to you now, okay?
Fantastic. Thank you very much. Hello, everybody. My name is Vernon Bainton, and it is my pleasure to be here with you today. And I'm going to talk a little bit about my very varied career and what getting into healthcare, and from there, how it springboarded and where I've gone with my career. And I'm then going to be talking about the application of creativity and better communications in terms of healthcare innovation and adopting change and improving outcomes for patients, clinicians, and health systems. Okay, so without further ado, a little bit about my background, so to speak. Now, when I was little, I still do really, I had a hankering to be an artist, okay? And I loved art, the application of art, pictures, imagery. I loved everything about capturing pictures, okay? However, I was also incredibly bookish, academic, a self-confessed nerd, if you will. So at that very pivotal time in my mid-teens, I actually didn't know what I could or couldn't do with art as a study, but did study maths, physics, chemistry, biology at A level. And from there, I was a scientist born and bred, and I loved people. Okay, so it seemed like a sensible move to go and study medicine. And I went to Birmingham University, where I studied medicine. I did an intercalated degree in neuropharmacology, and from there joined the NHS and started training. Initially, I started training as a physician, looking at my Royal College of Physician exams, and then I transitioned over into anaesthetics and thought about the Royal College path through anaesthesia, as I wanted to be an intensivist. At that sort of time, I still didn't really know where I wanted to go with my career, and I fell in with some fairly entrepreneurial medics, one of which had been a serial device developer, one had been a venture capitalist, and one had been a consultant, worked in business consultancy in pharma. And they basically showed me that my skills were readily transferable. And from there, I then moved to industry. So I worked for Big Pharma in Bristol Myers Squibb and Janssen Sealag, and I worked in medical affairs roles. So that was looking at their clinical trials and the application of their clinical trials in terms of the data gathering, the evidence. But I also worked in commercial roles, in the commercialization side of products and innovation. So marketing, sales, all of that good stuff. And from there, I realized that I could put my two passions together. So I moved into the world of healthcare communications, and over the years, basically ended up leading the medical and scientific disciplines within a large network agency. And I work internationally, and we work in medical education to educate clinicians around new treatment options and new services. We market products to health systems, and then we also do a lot of communications with patients. So it's all about improving health literacy, activating them, helping them with adherence. Okay, and that took me on to the career that I currently have. And what does that actually mean on a day-to-day basis? What it means is I could be working on, or we could be working on a vast variety of different products. Okay, we basically use best practice communications within our extremely regulated world. Okay, because the risks of healthcare and doing harm, we have to be evidence-based. We have to work within a very, very robust regulatory and compliance framework. But nevertheless, we might be communicating on real-time glucose monitors. So these are tools now that we can measure remotely real-time glucose fluctuations and help people with type 1 and type 2 diabetes better manage their glycemic control. It might be the application of analytics, artificial intelligence applied to decision making, and in this case, looking at cancer reporting within radiology. So you see a lot of this in the news at the moment because of the standard approach to X-rays and MRIs and CT scans. It lends itself very well to the use of algorithmic support tools. Oncology, a phenomenally exciting, interesting area, and we're working on a number of products internationally that help the immune system to see the tumors that you have in your body, because they are masked, they're cloaked, as it were, from the immune system. So we work in immunotherapy, or where we take T cells out of the body and re-engineer them so that they better attack blood cancers and infuse them back into people. And I'm also exceptionally lucky to be able to work on some of the coronavirus vaccines and help internationally tackle some of the misinformation and to improve health literacy and arm ourselves against the sort of anti-vaxxer sentiment and try and help people move over vaccine hesitancy. It's hugely varied. And the wonderful thing about science and medicine is it never stays still, right? So it's always evolving and changing and improving and being optimized as we learn more. And that suits me hugely because it allows me to have a lifelong career of learning, okay? And not only that, it's about adaptability and about change. So as well as my day job, I also do some other things on the side. Very lucky to have spent the last couple of years consolidating some research through London School of Economics. And in this case, it was looking at big data and data analytics and their application in precision, what's called precision public health. So whether that's the monitoring of the likes of COVID, whether it's track and trace, whether it's about improving health literacy or targeted interventions for different populations, it's about population level health. And the application of technology and digital tools, it now is extremely, the transformative change that we unfortunately have had to go through with COVID, but nonetheless, it's leaving us in an environment now where we can redesign what good looks like and prepare for future pandemics far better. I also am a mentor on the Clinical Entrepreneur Program. So this is one of the largest entrepreneurial programs in the world, and it's for healthcare professionals within the NHS to apply and get on a 2-year course where they're taught entrepreneurial skills. So this is about the application of innovation, new services, new thinking, new approach, but giving the broader skill sets and going beyond what was traditional training to really equip clinicians today with the skills they need to be able to apply their thinking, their services and their innovation within the NHS or within other countries internationally. And then last but not least, I'm on an advisory board for an independent research group called the Health and Happiness Foundation. And what we're doing is we're applying new tools to better measure patient-reported outcomes, better measure what matters most to patients within the health system, with a big focus on happiness in its broadest context, equity, justice, and improving outcomes for all patients, but within a way that's sustainable within the health system. That's exceptionally, it keeps me on my toes, and I'm exceptionally lucky to be able to do those things. Now, in order to do any of these, apply treatment services within healthcare, we have to handle evidence, and we have to handle data. And we live in a world of evidence-based medicine, right? But actually there's some problems and challenges with that. There is such a deluge of publications. It's extremely hard to keep on top of it. And it's extremely hard to navigate your way through different evidence bases and actually learn whilst doing your job and then apply them in a health setting. It takes about 17 years from a breakthrough piece of research published at a big conference, about 17 years later before that transformative approach is everyday clinical practice. And we're very interested in looking at different ways and means to shorten and accelerate that adoption cycle, but do so in a way that is credible, evidence-based, and is safe. So how do we think about doing that? Well, we apply simple tools, communication tools, okay? Sounds dead easy, but storytelling. Since the dawn of humanity, people, Homo sapiens, have told stories to each other. It's the way in which we help to understand the world. Facts and figures aren't that compelling. It's the context of those facts and figures, the context of your understanding of the world you live in, or the pathology of the disease you're managing, or the treatments and the interventions being used within a patient pathway. Those stories are how we understand the world and how we engage with each other and how we connect with each other. There's a wonderful old proverb from an indigenous Mesoamerican group: those who tell the stories rule the world. And over the last 15 years or so, we're starting to really understand some of the neurology and the psychology that goes along with that. When we look at new tools like behavioral economics to understand irrational behaviors in individuals. And then this research that came out by Yuri Hansen's group about 2010, it basically showed that stories aren't just told to each other, they're actually experienced. So a really good storyteller talking to you about an evocative scene, say it's at the end of a summer day and you've got a ripe mango that's beautifully yellow and smells ripe and delicious. That storytelling can actually activate the sensory parts of your cortex. Today, we have quite a big football game on. I don't know if any of you are watching it, with the Euro Championships, England, Italy playing. And if we were to describe a play in football and something motor-based, that similarly would activate those parts of your brain as you're talking about the winger running up the wing and then crossing it into the box. We're designed to respond and be activated by stories. And applying that in healthcare can be very, very useful. So what can we actually learn from the great storytellers? You know, be they Hollywood blockbusters or be they classic literature, you know, or contemporary stories? Well, actually, there's a fairly robust, commonly applied story arc to most stories. And we can use that and we can lean into it to help us tell stories in the healthcare and health innovation space. So you tend to get this opening where you're exposed to the characters, the heroes, the villains, the where and the when and the why, and the scenario that they're living in. And then you get rising action. So basically you get some level of jeopardy or conflict that tends to rise to a point where there's this climax of a decision needs to be made or something needs to happen, okay? And at that point, it's bringing together the sub-stories or the different characters, and it actually unfolds as a point of conflict, at which there is usually some sort of change. Thereafter, there tends to be a decrease in the level of a sort of urgency and the settling into a new world order, right? And the re-equilibrating. That resolution, that denouement at the end, is where there is a change. And the change to the individuals, that can be a good change, it could be a negative change, but ultimately it's about coming to some closure with that story. Okay. If that's the tradition, if that is an applicable, consistent approach to storytelling, how might we use that in healthcare settings? Well, we can use it in a number of different ways. It helps contextualize new evidence, okay, that we're gathering. It gives a better response from your clinician, from either the clinicians, the patients, or whoever your audience are, and they were either going to engage with it, find it more memorable, more interesting, more useful, more valuable, and they may well amplify it thereafter. So again, we can get into a virtuous cycle of engaging with people and having scientific discourse and education that actually results in change. So what does that look like? Well, applying it in a health innovation space, as you'd imagine. So who are the heroes? Okay, what's the clinician, the patient's role, their carer's role, the services and the treatments within that? What is the clinical unmet need? Okay, and what is the insight? What is the bit that's really going to help us enrich our understanding that needs to change? It's something that we can work on to actually improve the uptake of different treatments or services. Why is that new solution different or better? That is the evidence base, and that needs contextualizing and comparing, right? We might not have comparative data, so we need to help our audiences navigate that and understand it and be able to assimilate it as a whole and synthesize that. And again, you'd imagine you need to be persuaded to do something, and from there you would have some resolution. And this idea that you're then settling into a new state of equilibrium where you're doing something different, ideally better, particularly in the case of healthcare, obviously. So that gives you a flavour of what we do. And I want us to spend the rest of the time today giving some examples of what it looks like and what that actually means. So the first example, we were approached to do some education for GPs, so general practitioners, primary care clinicians. Over the last 20 years, massive strides have been taken in the diagnosis, treatment, and HIV services as a whole. However, there were certain things that were still an ongoing gap. Certain groups of patients were being underdiagnosed, okay, and left with a longer lead time without diagnosis and not necessarily getting treated. So we had to create a package of programs, and there was some education and some learning modules around this for GPs, but ultimately we did it around a hook of a short video that was to help them, remember different groups and to think about a whole load of symptomatology and different stories, patient stories that might help them consider testing for HIV. So if I can just ask Scott, we've got a video just to show you now of what that actually looked like.
Hello, I'm Val.
Of course. Hello, Val. Take a seat and tell me what I can help you with.
Well, Doctor, I came here last week to see you with a sore throat, and then the week before with an ache in my back and neck.
I see.
I have these disgusting cold sores that just won't go away. I have a rash all over my chest. I keep sweating during the night, and I've lost weight. I've had diarrhea for at least 10 days in a row. And I am absolutely shattered. What do you think it could be?
Recognizing the changing face of HIV can help you diagnose it sooner. With one simple blood test, you can make all the difference. Don't think twice. Think test.
Okay, thank you very much. So we're very proud of that video. When it was actually taken up and the response we got from the GP community was absolutely massive. And just on the side, if it's good enough to work with people like Ridley Scott's production company, so that was he's the director of films like Gladiator, taking a bit of beautiful film approach can really pay dividends in terms of engagement with educational activities. So the next example, again in the world of HIV, there was a milestone in terms of HIV treatments quite recently, and that was the discovery that if you were well controlled and you had undetectable levels of virus in your system, you would not be able to transmit it. And this was about a celebration for those for people living with HIV, and instead of suffering under the fears and concerns of it, knowing that actually if they were undetectable, they were effectively untransmissible at the same time. And this is a very interesting story because we approached it from a very humanistic approach, the everyday lives of people with HIV. And again, another video just to bring this to life for you.
There's nothing to see here. No tears, no shouting, no drama. The world isn't ending. Hearts haven't broken. They're just people living.
2 foot pound, 2 foot pound.
Living lives filled with fun and laughter.
Yes! I know you probably wanted half a pint, but come on.
frustrations, and worries.
What do you mean?
People getting on with
Just get off the bus
life.
and run.
Because people living with HIV are just that. People living like anyone else. And now there's something new you should know about HIV. A simple, happy fact. Thanks to effective treatment, a person with HIV whose viral load has reached and maintained an undetectable level cannot pass the virus on to anyone else. So there's nothing to see here, just people living.
Thank you very much. Again, we got a massive amplification from this for the community because it was telling the truism behind the everyday, mundane life of people getting on, living their lives. The next example I want to show you, children with dyslexia. Dyslexia is a major concern, and it's highly prevalent, actually. 80% of people in the UK are not diagnosed as dyslexic during their school years. So we were engaged to take some simple tools that help children to help parents to understand whether or not their children have difficulty with reading, and putting it in a way that actually normalize the whole reading experience, around the bedtime story. And this was a beautiful program of work revolving around a central story about a character called Andy and his adventures. It allowed us to bring to life not only some of the technical ways of helping to assess where children, how they are with their reading, but to debunk myths and to help parents get up to speed with exactly what they can and can't do and what support there is. Again, let's bring on the video and show you an example of this work.
Despite dyslexia affecting up to 870,000 children in the UK, less than 150,000 are actually diagnosed, leaving them without the vital support they need at a key time in their learning development. We needed to find a way to help parents spot signs of dyslexia. Introducing Andy Goes, the children's book that turns stressful tests into a bedtime routine. Working in collaboration with specialist dyslexia teachers, we took complex dyslexia screener tools and turned them into a bedtime routine, testing the child without them knowing they were being tested. The story was written to include key factors and early signs of dyslexia. The majority of the story used Fry's first 100 words, the first words that children by the age of 6 should be able to read. Failure to grasp these could be a key indicator. The muddled mountain became a key feature within the story, helping to highlight any issues with corrective partial decoding. This is where a child with dyslexia might find it difficult to fully visualize the words in their head, so mountain would become motorbike. The way the book was designed also acts as a detector. Off-white backgrounds are easier for a child with dyslexia to read than darker backgrounds. To ensure children don't feel like they're being tested, the guide for parents was designed to look like publisher's details, allowing them to get a genuine assessment of their child's reading ability. Andy Goes was made free to access to anyone who wanted it. Launched on World Book Day, Andy Goes made its way into thousands of homes. Schools began adding the book to their educational materials, and the book has been adopted across the globe, from the Bahamas to Australia, giving more children a better chance of diagnosis.
Thank you very much. So I hope that just shows how taking a simple format with the right tools and working in collaboration with some of the dyslexia education service providers helps us to improve the outputs of what we have that are truly engaging for all audiences and valuable. And talking about valuable, this is one of the pieces of work I was most proud of a few years ago. So depending on which country you're in, most countries have a massive shortage of organs for organ donation. 16 people a day die across Europe because of the need for organs, because of end-stage organ failure. We were engaged to work with the community and with one of the pharma companies and with some advocacy groups to talk about what the needs were for the community, and it became very apparent to us that actually it was all around the need for organs and organ donation, even more than talking about genetically modified organs or growing 3D printing your organs. What actually we needed was organs today. We created a program, and it was then shown on Channel 4 on demand, and in local cinemas, to connect to younger adults and to actually get them to opt in to the organ donation register and to sign up for it. And we used the idea of matchmaking, because it was so universally recognizable and so obvious for everybody that we used that as the vehicle to hook everybody in terms of the role and need for organ donation. And again, if we just show the video, and I'm going to tell you why, what happened afterwards.
So you know what, you really remind me of my ex. Only she was like a classical beauty.
What's your worst quality?
Big thighs.
Big guys?
No, I said big thighs. Said I was curvy.
You're curvy and, like...
Oh, hang on a minute. Are you saying I'm fat?
Oh, you're wearing heels.
Yeah,
You don't have to. Oh.
Yeah.
What?
What's wrong with pineapple and pizzas?
She just doesn't care.
She's great.
She doesn't actually really look that much like her.
So what do you do?
I'm a musician.
Oh,
Cool. I love olives, don't you?
No, I really don't like olives.
You want me to take my heels off?
it's just a little bite.
Lunatic.
Feel better?
I'm a dog person.
Ooh, no,
Yeah.
no.
Ah.
Just don't think we've got much in common.
I'm dying to meet somebody. Literally dying.
Thank you
First
very
time we
much.
made love.
So,
we just
we don't-
call it sex.
Let's go back to the
Well,
slides.
yes, we were.
Sorry, thank you. So, so that video went out, and we got thousands of people actually that ended up directed onto the organ donation register, and a number of people that signed up to that gives a conservative estimate of tens of thousands of individuals that would potentially be helped. However, the law was changed eventually a couple of years back. The law was changed as an opt-out system. So I was very pleased to say that actually now everybody has to opt out in this country, and it's radically changed. The stigma associated with it, and people need to now actually opt out of organ donation rather than opt in, which is a much better idea. Last couple of examples I want to show you. A few years ago, we were asked to work with some MS patients and Sanofi Genzyme, working with those patients with multiple sclerosis, and talk around brain health, talk around depression, cognitive ability, decision making. And actually, when we looked into it, there's a huge amount of stigma, an arcane language associated with mental health. Lunacy dates back to the old medieval times talking about this, and there was a lot of misinformation, and people weren't able to articulate themselves. They particularly weren't able to articulate themselves in modern settings, and the world needed a brain, and we gave it the emoji brain. So we applied to Unicode. It was accepted, and back in 2017, it had its first use, including on the likes of the Late Late Show with James Corden. If we can help people, some people talk about mobile penetration and emojis being the fastest growing language on the planet. If we can help anybody to debunk myths and stigma and allow them to talk about things like mental health and mental health problems, then that's an advantage to us, and allow us to actually normalize some of these discussions that are painfully absent. Talking about emojis. Emojis often get used for various things, and sometimes to avoid talking about taboos or difficult topics. This was a project involved with haemophilia, with people living with haemophilia needing to talk about sex and their sex life and intimacy when they have a disorder that makes them bleed. So So actually, this was a question of not using emojis, but actually getting people to articulate themselves and talk about it more open manner. So if we just show this video. Thanks, Scott.
The first time we made love.
Oh, we just call it sex.
Well, yes, we were having the sex, weren't we? And oh, yeah, I had that nosebleed, didn't I? Remember? Which, as you can imagine, was an absolute nightmare.
Oh, come on, it was well funny.
Don't laugh.
Oh, seeing you jump out of bed and like run into the bathroom.
I'd rather you didn't paint him a picture.
Oh, it was just a nosebleed. It's hardly going to like put me off you, is it?
I didn't know that.
You know, that was the night for me.
Really?
I properly fell for you that night.
Really?
I'm so glad that you were honest about your haemophilia.
Oh.
Fantastic. Okay, we're at the end of the act. Hopefully that's given you a flavour for the way in which we use contemporary approaches, communication, storytelling, creativity, and we apply them in a healthcare setting, whether that's to improve education and adoption and behaviour change within clinicians, within health systems, whether it's to support patients, their carers and families, to improve health literacy, to equip them to be able to have more effective consultations, to take ownership and empowerment over their own health, or whether it's to talk to other stakeholders within the healthcare setting. That's what we do, and that's what we love doing. And I hope that's given you a flavour of the sort of variety of work that I do and our company does, and about the role of creativity within all aspects of healthcare. Okay, to really help engender the best practice and change when it's needed and why it's needed. And with that, I think we're probably about at time, and shall I stop sharing and open it up for if there's any questions, really?
Yeah, well, thank you so much for speaking with us today, Vernon. You've shown some really insightful examples on just how being so creative and just reflecting on those examples can make a real difference in healthcare and how we communicate with others. Yeah, I do have a question. Do you think there's any ways that we can make changes in our day-to-day lives to kind of boost our inner creativity?
Oh, wow, that's a good question. I think there's a couple of things. There are tools that we use to get people to think in divergent and different ways. So we all have our skill sets and disciplines, and sometimes that leads us to think in certain ways. So by using some tools which is about diversity of thinking and divergent thinking, that can allow us to help tackle problems in different ways. So for example, we often create environments where you would have very mixed people together. So what's a philosopher or an artist or a sound engineer got to do with a clinician or a health economist or a patient advocacy group? Well, they have when they're working together within a shared agenda. And I think that's, healthcare is such a team sport. We have to sometimes look outside of our own sector to learn different ways and then apply them within the health system. So the thing to do is not get blinkered and be too siloed in your approach.
I think you've just hit the nail on the head, Vernon, haven't you? Interdisciplinary collaboration.
It's what it's all about.
We need to get out of our silos and actually see the world for what it is.
Exactly. Couldn't have said it better.
So great to have you join us this afternoon, and thank you so much for sharing not only your inspirational journey, all the work you've been leading nationally and globally, and of course for supporting our programme. Really looking forward to seeing how we can work more closely together to inspire not only the next generation but the current generation, and see how we can all work together to improve health and care.
Absolutely. A pleasure to be on this stage and have the opportunity to try and engage, inspire and motivate people to get involved in whatever part of the healthcare system. So if anybody wants to get in touch with me, or I welcome the opportunity of carrying on some of these conversations.
Amazing.
Thank you.